that have erasers at the end. She would use the rubber eraser. For convenience, we'll use our fingertips. For some of you, this is going to be totally comfortable. For some of you, this is going to feel a little more difficult. Okay, but I want to show you this because this is one of those rare examples. There's a few, but this is one of the few examples where you'll actually press the tissue straight inward into a body cavity. Using those surface tissues, as they press inwards, they will deform and gently move and or stretch the tissues inside of them. And if there's a nerve in that cavity and you can shift the nerve down into that cavity, that's a different way to get a stretch of those cutaneous nerves. Okay, so with pencil technique, this is where we're looking at the nerves that feed down into the arm, and they're typically gonna go under the acromion process and then down into the shoulder and arm area. So if he's got tenderness around the shoulder and some of the other stuff we've already done hasn't fully eliminated it, sometimes when I palpate in this area, it's like, is that tender right up in here, for example? A little bit. Yeah. Okay. So sometimes there might be a little tenderness right where we press, but sometimes it's going to be right around it. But what I'm going to look at is that there's the superior spine of scapula that comes up into and becomes the acromion, and then there is the clavicle, and they come together. And so you can find the two bones coming together like a V, okay? And that gap between the two bones narrows. So what I'm going to do is I'm going to feel for that gap between those two bones, and I'm going to look for the point of the V. I'm going to get as close to that point as I can. And I'm going to use a fingertip to go straight into that because there's a space, there's a gap in there. And I'm going to direct pressure into that to deform some of those superficial tissues down into that gap to shift those nerves and inwards, okay? So in the meantime, I'm also going to set the stage by giving a little bit more of a gap. And I'm going to do that partly by using one hand to draw his shoulder down and his arm down. I'm going to traction it down. Okay. In this case, we also got a free adjustment at one of his fingers. If I want to, I could use a piece of Dyson to do this, or I'm going to lift your hand for just a moment. I'm going to put a piece of Dyson down here. I'm going to draw it down and then plant his hand on a piece of Dyson so it's not as likely to slide down. So by drawing his shoulder down, now I can follow this in here and I can direct a little pressure straight into that gap. Any discomfort as I do this at all?
No.
Okay.
I can't tell if it's this hand's getting regulated by that's why, because you're doing the stretch on the hand. It's distracting you.
What is it that you feel by the hand?
It feels that's, it's relaxing.
Okay, cool. Sometimes when we were doing this, people will verbalize interesting things. Sometimes you'll see their breathing shift. Sometimes you'll feel twitching or something like that. Okay, but basically I'm just trying to maintain, like, since I've tractioned the shoulder and hand down towards the feet, and then as I direct pressure straight into that cavity, I'm just going to maintain this. So for my fingertips, this is no big deal. If for your fingertips, this is more of a deal. I think there might be a few pencils with erasers that you guys can practice with as well, because there's no reason why you can't.
So would you say you're going deep, or is it just?
I'm just trying to stretch. I'm just trying to shift the nerves. And in this case, the easiest way to shift these nerves is to direct pressure straight in over the top of them, pressing them down into a gap, rather than trying to stretch them lengthwise. So it's a different way of shifting the nerves where they're located.